First of all, what is telehealth? Telehealth is like Zoom, it's like FaceTime. You'd see me as a psychologist like this, and we'd see each other face to face and talk over the internet.
Telehealth has been one of the single greatest things that has happened of late. And I talk of late because it now means that both user ends feel much more comfortable with video conferencing.
I support people therapeutically all over Australia. Actually, I support people internationally through telehealth, and that's been one of the incredible movements that we've all gone into over the last 12 months, where a lot of people who prior to that only thought about face-to-face therapy. Now people understand that you can actually be anywhere, at any time, any point of the day, and be able to connect with somebody that can give you support.
So there are a couple of advantages of telehealth. You don't need to leave the house. You can have your pick of professionals. I personally have an online counsellor. I've got a psychologist in Melbourne who I've never met in person, and we only meet online. And I have a counsellor in the US who we haven't met in person. So the advantages of that are that you can have regular contact and better services without the barrier of having to find someone in your local area and actually get out to them.
Telehealth I've found has been incredibly useful, but it can be incredibly overwhelming. As we know, being in front of a camera and Zoom, it can be quite intimidating. It can also be mentally overwhelming because the amount of information that you're doing, and if you're doing it multiple times a day, communicating with people through that way, it can really impact on how you're feeling. From my experience when working with clients, you don't have to have the camera on when you're talking through telehealth. You can quite happily sit there, turn the camera off, you can sit there in your PJs, have your cup of coffee and have a bit of a chat with the person that you're talking to at the other end.
There are a few tools you can use as well. You can have a virtual whiteboard. I can share my screen if there was a worksheet or information that I wanted to go through you with. You could share your screen if you had something you wanted to share.
I think one of the things to remember is if you are comfortable in your own space and home, if you can control your environment, then you may not have the sensory difficulties of entering somebody else's space. That's one of the really great benefits of it. The other thing is that there's incredible capacity on telehealth to be able to share information, which means that people are able to really, really quickly share a screen, which means you can Google something together and look it up together. You're able to draw pictures together. People are able to give visual representations constantly. Sometimes if you don't want to even look at somebody's face, you can get rid of that completely. It's not just a flat screen. It's really clever.
It's really easy, it's really simple, often just a click of a button and you're live with your therapist. You don't have to travel, we can do it around your workplace or your timings or your other commitments.
I don't feel comfortable doing it now. I might just want to do 30 minutes, I might just want to do 20 minutes catch up. This is what we need to touch base on, and then you could say, can you email through something for me? What sort of strategies do you want to touch on this week? Or some literature that I need to research, because I quite often do that with clients as well. I tend to try and leave it to how much they would like to discuss and talk with me, and then I'll also give them the option of going, here's some other information, you can go and research and do this in your own time when you're feeling up to it and when you're not feeling quite so overwhelmed.
There are some circumstances, like for sometimes with social skills practice or anxiety exposure work, I'm going out into the community, I'm going into malls, we're getting on buses, and we're actually physically practicing the skills, which is really, really helpful. So that is a limitation.
There are some disadvantages as well, and telehealth doesn't suit everybody. But whether it's just a phone call or whether it's a voice call as well, there are quite a few ways to interact with people online. Some counsellors offer chat services as well. And if someone is able to offer you a service that you can access, it is a lot better than not being able to access any services at all, or even settling for a psychologist where you don't have a good relationship with because they're the only one in your area.
People often report that they find it really hard to have both the visual screen and the audio. So it is possible to do phone appointments for those that are really struggling in that area. On the other hand, you can do things like ask for a shorter session length. you can ask for it to be slightly modified so that at times you're doing phone and then you're doing video, or sometimes you're complementing it with face-to-face. But at the same time, you'll find the cued information from visual is actually quite comforting. So it's nice to see the reinforcement and the expression of the person across from you as you work through something, and it can give you access to a whiteboard. You can also usually turn off the video of yourself. Sometimes watching yourself on screen can be quite distracting.
Understanding about yourself when you're at your best. So you may be a morning person, or you may be an afternoon person. You may feel better earlier in the week than you are later in the week. So have a think about, when do I want to organise my appointments? So I know for me, if I have it beginning of the week earlier on, I will be far better because I've had a weekend that's been restful. I haven't had a whole week of lots of different things that be mounting up. So if it was by a Friday, I'd be too stressed, I'd be too overwhelmed. It'd be a case of, I will get on there and this is what it is. See you later, I've had enough for this week. So have a think about when your energy is going to be at your highest and try and organise things like telehealth around that.
But ultimately, I think it's a really great thing. And it's really great the government's funding that under the Medicare scheme as well, under a GP mental health care plan, where you get that rebate back.
So I would really, really encourage you to give telehealth a go and modify it to work with what's best for you. So that might be an increased frequency of appointments of shorter duration, but having that video on really enhances your learning and your skill development.